Every day, millions of people suffer from nagging joint pain, swelling, or that sluggish feeling that just won't go away. And while many spend hundreds on medications or supplements with little to no relief, a breakthrough could be sitting right in their kitchen cabinet. A single, common spice used in everyday cooking has been found to dramatically reduce inflammation in as little as 3 days. This isn't about trendy diets or miracle pills, it's about one natural ingredient backed by science, trusted by ancient medicine, and now proven to fight the root cause of pain and fatigue. Viewers over 50, in particular, should pay close attention, because this simple addition to their routine could change the way they move, feel, and live, without prescriptions, without side effects, and without delay. Inflammation is at the root of countless health problems, from joint stiffness and chronic fatigue to serious long-term conditions like heart disease and arthritis. While most people treat the symptoms, few ever address the actual source. But new research and ancient wisdom now point to a simple and powerful solution hiding in plain sight. In this video, viewers will discover the one spice that not only adds flavor to meals but also acts as a potent anti-inflammatory agent. It's affordable, easy to use, and available in almost every kitchen. For those over 50, this could be the key to reducing discomfort, boosting energy, and supporting healthier aging, all without drastic lifestyle changes or medications. Chronic inflammation is a silent and persistent condition that affects millions of people without their awareness. Unlike the short-term inflammation that occurs when the body heals from an injury or infection, chronic inflammation lingers for months or even years, quietly damaging tissues and organs. It often begins with minor symptoms such as fatigue, mild joint discomfort, or digestive issues, but over time it can escalate into serious health concerns. Scientific studies have linked chronic inflammation to a wide range of diseases, including heart disease, diabetes, Alzheimer's, and certain types of cancer. For older adults, this low-grade inflammation is especially dangerous, as it accelerates the aging process and weakens the immune system. Known as inflammaging by researchers, this phenomenon makes the body more vulnerable to infections, muscle loss, cognitive decline, and reduced mobility. Factors contributing to chronic inflammation include poor diet, lack of exercise, stress, environmental toxins, and even undiagnosed infections. The challenge is that inflammation does not always cause pain or noticeable symptoms in its early stages, making it difficult to detect. This is why many people live with it for years without realizing the long-term damage it is doing inside their bodies. Blood markers like C-reactive protein, CRP, can indicate inflammation levels, but most people never get tested until a major health issue arises. Preventing and reversing chronic inflammation is crucial for maintaining long-term health, especially as the body naturally becomes more vulnerable with age. The good news is that the root causes of chronic inflammation can often be addressed through simple lifestyle changes. One of the most effective approaches is targeting it through diet by introducing specific anti-inflammatory foods and nutrients that help calm the immune response. Among these, certain spices have shown incredible promise, not just as culinary ingredients but as powerful tools for healing and prevention. In many kitchens around the world sits a humble spice with extraordinary healing potential: turmeric. Often used in curries, soups, and stews, turmeric is more than just a flavorful ingredient. It contains a powerful compound called curcumin, which has been studied extensively for its anti-inflammatory and antioxidant properties. While turmeric itself has been used in traditional medicine for centuries, modern science has only recently begun to fully understand its impact on chronic inflammation. What makes turmeric so remarkable is that it works on a cellular level, blocking molecules in the body that trigger the inflammatory response. This includes enzymes and signaling pathways that are typically activated when the body experiences stress, injury, or infection. For seniors, incorporating turmeric into their daily routine could mean not only reduced joint pain and stiffness, but also improved energy levels, better digestion, and enhanced cognitive clarity. What's even more compelling is that turmeric is already found in many households, making it an accessible and affordable solution. Unlike synthetic drugs, which often come with a long list of side effects, turmeric offers a gentle and natural alternative. It can be added to tea, blended into smoothies, sprinkled over roasted vegetables, or taken in capsule form as a supplement. Some studies suggest that with consistent use, noticeable reductions in inflammation markers can occur in as little as 3 days. While curcumin makes up only a small portion of turmeric by weight, its impact is substantial. However, because curcumin is not easily absorbed by the body on its own, pairing it with black pepper significantly increases its bioavailability. This simple combination turns an everyday spice into a potent anti-inflammatory remedy. For seniors looking to take control of their health without relying solely on pharmaceuticals, turmeric presents a safe and natural option. It is easy to use, widely available, and backed by a growing body of scientific evidence. What once was just a colorful powder in the spice rack may now become a daily staple for protecting long-term health and reducing the hidden dangers of chronic inflammation. Within just 3 days of consistently incorporating turmeric into the daily routine, noticeable changes can begin to take place in the body, especially for those who have been silently suffering from chronic inflammation. One of the earliest effects reported is a reduction in joint discomfort and stiffness, particularly in the morning when inflammation is typically at its peak. This improvement can make everyday tasks like walking, bending, or climbing stairs noticeably easier. At a cellular level, curcumin begins to inhibit the activity of key enzymes responsible for triggering the botus inflammatory response. By doing so, it helps calm down overactive immune reactions that often lead to tissue damage and discomfort in muscles and joints. As inflammation subsides, individuals may also notice a subtle increase in energy and mental clarity. Chronic inflammation can drain the botus resources, leaving people feeling constantly fatigued and mentally foggy. With this burden reduced, the body can redirect its energy toward healing and regeneration. Blood circulation may improve as well, allowing more oxygen and nutrients to reach tissues in need of repair. Some also experience improvements in digestion, as curcumin has a calming effect on the gastrointestinal tract and can help reduce bloating or discomfort related to inflammatory conditions like IBS. Although results vary depending on the individual's condition and consistency of use, the initial 3-day window often serves as a turning point. Inflammation markers such as C-reactive protein, CRP, may begin to decrease, and subtle shifts in overall wellness become more apparent. For seniors who have struggled for years with nagging aches or systemic fatigue, these early changes can be both empowering and encouraging. It's not a complete transformation overnight, but it's the beginning of a meaningful shift toward long-term relief and better quality of life. Across the country, countless individuals have experienced profound changes after introducing this common spice into their routines. One woman in her 70s who had struggled with arthritis for over a decade began adding turmeric to her morning tea. Within a week, she noticed less swelling in her fingers and knees and found it easier to complete simple household chores without constant pain. A retired teacher who once relied heavily on over-the-counter pain medication reported that after consistently using turmeric daily, he was able to reduce his dependence on pharmaceuticals and felt a renewed sense of control over his health. His daily walks, once limited to a few blocks, gradually extended to full miles without fatigue or joint strain. In another case, a man recovering from surgery shared how inflammation had slowed his healing process. Upon learning about the anti-inflammatory power of curcumin, he began supplementing with it under his doctor's guidance. His post-operative swelling decreased noticeably, and his physical therapy sessions became more productive. His doctors observed quicker than expected tissue recovery, and he was able to regain mobility sooner than predicted. These kinds of changes, while anecdotal, continue to appear in stories from people of all backgrounds and age groups. Even those without a diagnosed condition but who lived with unexplained aches, digestive discomfort, or persistent fatigue have shared that after adding turmeric to meals or using a standardized supplement, their bodies felt lighter, digestion smoother, and energy more stable. Some noted clearer skin and better sleep, which they had not even associated with inflammation before making the change. While the spice may not work identically for everyone, these shared experiences offer encouraging evidence that natural solutions can bring noticeable improvements. What connects all of these stories is not just the physical relief but also the emotional shift that comes from feeling hopeful again. For many, turmeric became more than just a spice. It became a daily tool for reclaiming wellness and restoring a sense of vitality once thought to be lost. Scientific research has increasingly focused on the anti-inflammatory properties of turmeric, specifically its active compound curcumin. Numerous peer-reviewed studies have demonstrated curcumin's ability to regulate inflammatory pathways in the body by targeting molecules such as NF-κB, a protein complex that plays a key role in chronic inflammation. In one landmark clinical trial published in the journal Phytotherapy Research, patients with rheumatoid arthritis who took curcumin supplements experienced significantly greater reductions in joint pain and swelling compared to those given standard anti-inflammatory drugs. Not only was curcumin effective, but it also came without the gastrointestinal side effects commonly associated with conventional medications. In another double-blind, placebo-controlled study, curcumin supplementation over just a few days led to marked decreases in blood markers of inflammation such as C-reactive protein, CRP, and interleukin-6, IL-6. These biomarkers are associated with a variety of chronic diseases including heart disease, diabetes, and Alzheimer's. The rapid improvement seen within a short period highlights curcumin's fast-acting nature, particularly when taken in bioavailable forms that enhance absorption. Researchers have also noted curcumin's antioxidant capabilities, which help neutralize harmful free radicals that contribute to inflammation at the cellular level. Moreover, a meta-analysis involving multiple clinical trials confirmed that turmeric extract consistently reduces inflammation-related symptoms across different populations, from healthy adults to patients with chronic inflammatory diseases. Scientists believe its broad impact stems from its ability to influence gene expression and enzyme activity related to the body's natural healing process. These findings have been widely recognized by the medical community, prompting further investigation into curcumin as a complementary therapy. The accumulated evidence clearly supports turmeric as more than a culinary ingredient. It is a potent, natural anti-inflammatory agent with measurable benefits in as little as 3 days when used correctly and consistently. To experience the full anti-inflammatory benefits of turmeric, it is essential to use it in the right form, dosage, and combination. Curcumin, the active compound responsible for turmeric's powerful effects, is not easily absorbed by the body on its own. To enhance bioavailability, it should be consumed with black pepper, which contains piperine. Piperine has been shown to increase the absorption of curcumin by up to 2000%, making it a crucial component in any effective turmeric regimen. Additionally, pairing turmeric with a healthy fat, such as olive oil or coconut oil, further aids in absorption because curcumin is fat-soluble. Experts recommend using high-quality turmeric supplements that clearly indicate standardized curcumin content, usually around 95%, and include black pepper extract or piperine. For those who prefer a natural approach, incorporating turmeric into daily meals is also effective when done consistently. This can be achieved by adding it to smoothies, teas, soups, or stir-fries. Golden milk, a traditional mixture of turmeric, warm milk, and spices, is a popular and enjoyable method of consumption. However, relying solely on culinary doses may not deliver therapeutic levels, so supplements are often recommended for those with chronic inflammation. The timing and consistency of use are also important. Taking turmeric daily, preferably with meals to maximize absorption, leads to the most noticeable benefits. People who use it sporadically or in very low amounts may not experience the full impact. Depending on individual needs and health conditions, it may take a few days to a few weeks to observe clear results, but for many, improvements such as reduced joint stiffness or improved mobility begin within the first 3 days. By understanding the correct way to use turmeric, individuals can unlock its healing potential safely and effectively. For those struggling with chronic inflammation and its daily toll on the body, a simple shift in the kitchen could make a profound difference. Turmeric, the common spice found in many pantries, has shown the power to ease pain, support joint health, and restore energy when used consistently and correctly. Backed by science and real-world results, its impact can often be felt in just a few days. Seniors and adults alike have embraced it not only for relief but for reclaiming their quality of life. Now is the time to take small, natural steps toward better health. Incorporating this one spice into a daily routine could be the easiest decision with the greatest reward.